Hey everybody, Dr. Shook here. Hope you're doing well tonight. So today I am really want to talk to you all about the major reason that we have hormonal imbalances today. And there are a lot of reasons, but the primary reasons that we have hormonal problems is really what I want to get into and discuss because it's such an epidemic. Um, it is rare that when I'm working with someone in a clinical setting, I'm working one-on-one with someone that we don't identify hormonal problems, whether that be, keep in mind with all hormones in the body, there are 4 different phases of physiology that has to be considered, right? All hormones. So it doesn't matter what you're talking about. If you're talking about thyroid hormone or estrogen or testosterone or progesterone or cortisol, any of the hormones in the body, there are 4 phases of physiology that must always be considered. And so you always have to look at the production. So is the quantity of the hormone correct? Then you have to look at the transportation. Can the hormone be transported through the blood via the little carrier proteins? And then you've got to look at the sensitivity of the body to the hormones, and you've got to look at the detoxification and breakdown and elimination of the hormones. All these things are important, and the physiology can break down at all of those different stages and usually multiple ways, and that can lead to a lot of the symptoms that people have. But I really very commonly I find that we have problems with sex hormones. The thyroid is a huge issue, but we find that there are a lot of problems with sex hormones as well, with estrogen and testosterone and progesterone. And so there's one of the main, I guess the main thing that when it comes down to one of the primary things I would say, and there are a lot of different things. I don't want to just say this is the only thing because it's definitely not, but that you primarily will see stressors, and there are many different types of stressors, but you will see that stressors drive an adaptation of your biochemistry that leads to imbalance in your hormones. Okay, so stressors, we primarily look at 3 different types of stressors. Hey, Charla, hope you're doing well. You'll see that there are 3 different types of stressors. So we'll tend to see that there is an chemical stressor. Okay, so that can be high inflammatory load, which we talk about a lot because it's such a big problem. You can see chemical stressors such as environmental chemicals that can disrupt the endocrine physiology. And so that's going to break down the physiology different ways. Inflammation tends to decrease production, breaks feedback loops, like how the brain signals the glands to make the hormone. It can disrupt the feedback system. It can disrupt sensitivity at the cell. It can do a ton of different things. But then endocrine disrupting hormones often mimic the hormones that our body make, and they can block receptors. They can create a lot of issues in and of themselves. And so we've got chemical stressors, we've got emotional stress, and we've got physical pain. And all of these things, what you'll see that tends to happen is that with any of these stressors, our body will tend to compensate for this stress by producing cortisol, our stress hormone. So if you're in pain, your body will produce higher amounts of cortisol because your body will adapt via a sympathetic response, a fight or flight response. If you have emotional stress, your body will adapt, and one of the physiological responses to stress is the production of cortisol. Okay, now this is important when it comes down to how that affects your sex hormones because they're all part of the same chemistry. And then if you have chemical inflammation, your body will produce cortisol because cortisol is anti-inflammatory. So the stressors that we are under, some of them are psychological, some of them are biochemical stressors. These things have to be considered, and these things have to really be considered. I think that this is the greatest epidemic of our time is actually stress, and stress placed on our body in a chronic or a long-term state that causes our physiology is not equipped for that. We're not adapted to that, and we see a lot of chronic health conditions. The primary reasons that people go to their primary care doctors are many of the top reasons are because of stress-related illnesses. It's a huge problem. So when you look at this and you start realizing that we're under chronic stress and that your body will respond. It's not like something that doesn't have an effect on the body. It has a very profound effect with the production of cortisol. And one of the things that cortisol will do when you produce it at a high rate, it will deplete some of the hormones that you need to produce your estrogen and to produce your testosterone and to produce your progesterone. What ends up happening is a lot of people start having these symptoms of estrogen dominance or of low progesterone or of low testosterone. And, in women, it's very interesting too, because when you start seeing some of those symptoms that can arise, and you'll see things like mood-based problems as well, like you'll see low libido, which can be tied to a few different things, loss of pleasure, disinterest in sex, or loss of pleasure in sex. Those are also neurotransmitter based, like neurochemical, like your dopamine is one of the primary things that you'll see can be affected. And so that's one of your brain's chemicals, and it helps you with pleasure and in enjoyment. And so when cortisol tends to be higher and you're under this chronic stress with higher cortisol, it affects your brain's signaling of your glands, of many of your glands, because it disrupts the feedback loops. Our hormonal system works by the brain signaling. Usually the brain, central structure in the brain signals your pituitary gland. And your pituitary gland, you know this now, if you followed me with the thyroid, you understand I talk about that a lot because that's how the thyroid works. The brain signals the pituitary gland makes thyroid stimulating hormone, or TSH, which signals the thyroid to pump out more T4 and T3. When those levels go up, the brain is monitoring it and will adjust the signals to the pituitary gland accordingly. Now that's if that feedback, that's called a feedback loop, okay? If that feedback loop is working appropriately, then the brain regulates and will adjust the amount of stimulation to the pituitary that then adjusts and has an impact on the amount of TSH that's being produced and how much signaling the thyroid gets. And so it's all this balance. It's called a negative feedback loop. Okay, it's a feedback loop, and that's just with the pituitary or with the thyroid. So almost all your hormones have this feedback loop. This feedback loop can be disrupted. Elevated cortisol can disrupt the feedback loops, and a lot of different things can do it. But when we're talking about stress in particular, it starts to break down the physiology quite a bit. And you can also, it will impact dopamine, and it can create a lot of issues. Now, what ends up happening is that rather than, and sometimes I think that it is understood that these stressors are creating these physiological imbalances, but it's rare in general, in our general practice with most of our doctors, because that's not the classical training, and they're really just trying to help you feel better and figure out if you're dying of something. If you have a disease process that is going to, something that's very serious that could be life-threatening, or if this is some kind of chronic disease state or chronic state of declining health that may be related to stress, that's really not what they're equipped to help you with. Not because they don't want to, it's just that's not in the books, that's not in the training, that's not part of that system. And it's not that they don't want to help, but it's just that there's not a tool that they have in their toolbox to help you with that problem. So it's a huge issue here. This is the biggest problem, because with this increased production of cortisol that tends to happen in the short term, like whenever you're put under these stressors, initially cortisol tends to be high. You deplete these hormones that are needed, and then you have these sex hormone imbalances that are often what's checked. Like, okay, you have a set of symptoms that are typically associated with like low hormones, or let's say estrogen, high estrogen. And then so your doctors check those levels, and if they are imbalanced, then they may want to consider giving you a hormone, right? Which to try and help the symptoms. But what's driving the hormonal imbalance there, right? What's driving that? Now, some people, so looking at the hormone levels is reasonable, but you always want to consider the pituitary hormones. Because remember, like when we look at the thyroid, when you're thinking about your thyroid hormone, what's always checked? What is primarily checked in practice? TSH, right? Thyroid stimulating hormone, TSH, and that's a pituitary hormone made by your pituitary gland. Why do they look at that to see if there's a thyroid problem? Because it's a signal coming from the brain, for one thing, and they think, well, the brain's the master controller and regulator of the body. So let's look at what the brain is trying to signal the body to do, rather than just looking at output of E3. So they're trying to look at what the brain's signals are, what signals the brain is giving the thyroid. So when you have sex hormone issues, you don't think of it as like in the context of what I just said about the thyroid. They don't want to look necessarily just at your estrogen or your progesterone. They also want to look at the pituitary hormones responsible for the production of those hormones, right? So you think about the thyroid, they'll check TSH, and then hopefully you'll get some quantitative markers for T4 and T3. When you're looking at sex hormones, you want to look at like estrogen, you want to look at like your progesterone, you want to look at your different estrogens for one thing, you want to look at your testosterone, but then you also want to look at like your cortisol and see if you're overproducing cortisol, or if there's a problem with the precursor hormones, the hormones that are needed to make your estrogen and your testosterone and your progesterone. So you want to look at what they call the steroid hormone pathways. You just want to look at it and see like, okay, what's happening here? Do we see adaptive biochemistry? Is the body compensating for something that might be causing an inability or a temporary adaptation of an inability to produce estrogens? Now, when you see this, you want to understand what the pituitary gland is trying to do as well. Because if someone has, say, like their estrogens are low or the progesterone's low, you want to look at the pituitary hormones. Because if the pituitary hormones aren't high, because think about it in the context of the thyroid. If your thyroid hormone is low, okay, the quantity, what the thyroid's pumping out is low, what is the TSH that the pituitary gland makes? What is it like? How would the levels be? Is it going to be low too? If your thyroid hormone is low, is your TSH level typically, if everything's working, we're not talking about like a pituitary tumor or anything like that, what is going to happen? TSH is going to be high, right? Because the brain, if the thyroid hormone's low and the feedback system's working in the body, the brain's going to be saying, pituitary gland, make more stimulating hormone, because the stimulating hormone ramps up production of the thyroid hormone. Right? So if the thyroid hormone's low, the brain and the feedback system's working, the brain's going to be trying to signal the pituitary to make more hormone, right? So if your estrogens are low, or progesterone's low, or testosterone's low, you want to look at the pituitary hormones. And if it's a, if you will know if someone they have true, like what we call like a primary gonadal failure of like the ovaries, so the ovaries can't produce the estrogen, you'll tend to see a high it depends on what you're looking at, but you'll see either a high LH, luteinizing hormone, or FSH, follicular stimulating hormone, FSH. FSH and LH are the ones you want to look at, and you want to see, so you'll expect to see them high if there's a problem with the gonads producing the hormones, okay? So it's just like think of the pituitary the same way, right? TSH is elevated, so the thyroid, there's a primary failure with the thyroid to produce enough hormone. Now, when the doctors see that, they're like, oh, okay, it's a gland problem, because the brain is signaling signaling the thyroid, or the brain, the pituitary gland is signaling the ovaries, but the ovaries aren't responding with more hormone. So then they want to supplement with the hormone at that point. Okay, does that make sense? The gland is failing to make it. And then they want to supplement. If you have lower estrogens or progesterone or testosterone, but your FSH or your LH are not elevated, that is not a primary failure of the organ. The organ can probably still make it. There's some kind of other adaptation that's at play. Something else is going on. And so you see what I'm saying? Does that make sense? I know you might want to listen to that again, but you're trying to understand, where is the problem, right? So where's the problem with the production of the hormones? Because what we often see, coming back to the stress, is that the stress will cause an adaptation where the body is producing more cortisol, or it has been producing cortisol and it is not able to produce cortisol. And a lot of the precursor hormones, the hormones that are needed to make cortisol, are the same hormones that your body uses to make estrogen and testosterone. Okay, so if you deplete them, then you'll run out of some of those precursors, and you'll have issues with your steroid hormone production. So there might be an adaptation there that is something that's driving that's depleting your ability to produce, or running down, diminishing your ability to adequately produce your sex hormones. And then you want to understand, what I'm getting at here is you want to try to understand why. Like, what is going on, so that you're not just completely doing symptom-based management, and which may not be what the body needs, right? I mean, it may not really, whatever's driving this is what you really want to try to address, so that the body can compensate and function optimally, normally, right? Not necessarily, it's trying to understand, this process is trying to understand the chemistry better, so that you're doing what the body needs and you're not forcing chemistry upon it, right? And that's tricky, because I think that there are times that the body needs support. I mean, definitely, but it's really common to, I think, miss that sometimes, and not know what to do, even if you can kind of identify that something's not right, But this is a huge thing, because stress is a huge issue. And the interesting thing about stressors too is that stress is very contextual. You'll see that it's, and I've talked about this a little bit before, but people will perceive stressors different, right? It's your perception of it. Like 99% of the stress out there, like the emotional stress, a lot of the stress that's forced upon us in an emotional stressors, most of that it's how we react to it. It's how we perceive it, and people will perceive stress differently. And that's really, really helpful to get some context, and to be able to look at the stress and say, this is, if it's out of your control, you make peace with the stressor, and you decide to respond differently. It's easier said than done, I know that, but at the same time, you have to be able to give yourself some freedom and some leeway, because if you think about this for a second, and here's a good example of perception. So someone once told me a story about this to try to illustrate the point, and I thought it was kind of interesting. So someone that I know was telling me about this, and he said, I was driving down the road with my wife, and he was looking out in the field, and he saw all these cows, and they were wagging their tails, and he was like, "Oh, look at those cows! They must be really happy," And he looked at them wagging their tails. And his wife grew up on a farm. He didn't. I didn't, but I did have a pasture directly behind my house, so I do know this. She said, "Well, the cows aren't wagging their tails because they're happy. They're not dogs. They're actually wagging their tails because they have flies all over them that are probably biting them, and so they're kind of swatting them away." So he was thinking those are happy cows, and she was perceiving them as being probably uncomfortable. And so it's the perception of what you're observing and what you're experiencing that I think is important. But it's the context of the stress that's important, and so people perceive things differently, right? And so I think it's if we can get some control over our perception, and we can control that response, you control your stress response. You physiologically change your stress response, and breathing is a really powerful way to do that. Breathing is an incredible way. There are just a lot of different tools out there and techniques, but I think breathing is one of the best. Now, the things that we can't really control as much are like these inflammatory stressors. These are the things that are kind of like happening to us, and it's like, well, how do I control the inflammatory stressor? Well, it's something that you have to identify if it's happening, and then you have to try to track down what is the driver of the inflammatory stressor, and then based on what is actually happening, then you try to formulate a strategy of diminishing it. Now, for a lot of people that have inflammatory stressors, it's there are a combination of things. Like everything works together. Right? Everything in the body's connected. So when someone's experiencing an inflammatory stressor, and let's say it's an autoimmune process, there's a lot of different factors that we think drive the autoimmune processes. I've talked about them quite a bit. Foods, pathogens, chemicals, deficiencies, where the body doesn't have what it needs for proper self-regulatory function, for proper biochemistry and elimination. And then there are things that are like lifestyle related, right? So I've talked a little bit about how sleep and lack of sleep can drive and promote a tremendous amount of inflammatory chemistry, right? We know that like the genes that are upregulated when you don't get sleep, there's something like 7,000. And many of these are in regions of coding for our DNA that are known to be associated with the inflammatory pathways, like upregulating inflammatory chemistry, like lack of sleep. So when you start looking at this and you're thinking, well, what can I do? I don't have things in my control. Or there's people will often have reasons that they can't succeed because they're just really uncertain, or maybe they think there's only one way. I truly believe that there are multiple ways to positively influence your health, right? So somebody might say, well, you have to change diet. Well, maybe what if you just slept well? What if you could just start sleeping and getting a sleep rhythm, and all of a sudden you're changing your biochemistry and hormonal physiology is changing despite diet, and the body's better able to compensate and address, let's say there's some type of infection or something that you have, or chronic yeast overgrowth or something, but the sleep downregulates inflammatory chemistry. Your immune system is better able to cope with it, and then you start having more regular bowel movements, eliminating this stuff, and you heal through sleep. It's not that far-fetched. I mean, so there's multiple ways to intervene, I think, with these problems that we have. And so that's why attacking them from as many points as possible, as many directions as possible. So diet, lifestyle, temporary supplementation to improve immune regulatory function, or nutrient issues, our perception of things. If you're in physical pain, a lot of the things I just mentioned may help with physical pain, may downregulate inflammatory pathways naturally, and then it all works together. It's also interconnected, and so I think, in the same token, that you can have just a few things that can be driving these problems that might be working against us as well. Like, it's hard to understand, like, well, what might be driving this? Well, there's a lot of different things. That's why we have to take such a comprehensive and more broad approach to diet, lifestyle, stress. And we have to think about all these things, right? That's why we can't be so simplistic in saying, there's just one thing that we need to do. We're a complex organism with a lot of different systems, and there are a lot of things going on. So in a complex system, you can't reduce it and simplify it to just one thing. That's why a lot of the approaches fail, because there's an oversimplification. Hey everybody, hope y'all are doing well. Hey Elaine, Robin, Bridget, hope you guys are all doing well. So LH and FSH are not high with possible underlying causes. So interestingly, okay, so if you have low hormones, so think about this for a second. If you have low hormones, but you're or on the low end, but your FSH and LH are not high, which we were kind of talking about. Like, so those are the pituitary. FSH and LH are the pituitary hormones, and your sexual hormones are signaled by those pituitary hormones to increase in production. So you would think that if it's a primary problem with let's say the gonads or the ovaries, then the pituitary hormones would be high. Just like if you have a problem with your thyroid and its ability to produce thyroid hormone, the thyroid hormone's low, but the TSH, which is the pituitary hormone, is high, because the brain is trying to signal the thyroid to make more hormone. So it's doing so by pumping out more TSH, but the thyroid is not responding to the TSH and producing enough. So the doctors go, okay, we need to supplement with a hormone here. Okay, does that make sense? So if your gonads or your ovaries are not producing the hormones, then you want to look at the pituitary hormones to see if they're high as well, because it should be just like the scenario that I laid out if the ovaries have an inability to produce enough of the hormones, right? You should have high FSH, LH, you should have, and then you would have the lower hormones. Now, if the FSH and LH are low or normal, but the sex hormones are low or on the low end, then you need to look at that stress physiology. You need to look at cortisol to see if you're in what's called like a cortisol steal or a pregnenolone steal. And then you want to understand, well, if you are, that's typically due to stress. What kind of stress is? Well, there's physical, what we just talked about, right? There's physical pain, there's emotional stress, there's chemical inflammation, right? So the body's typically producing more cortisol in an attempt to address and compensate for stressors, okay? So, but you've got, I mean, that's still kind of a simplistic approach. You want to look at everything. You want to look at the thyroid hormone, because the thyroid hormone and the thyroid physiology very well. Because why? Because the thyroid hormone sets the metabolic rate for every single cell in the body, including the brain, including the end tissues, the gonads, all of your glands that produce hormones. Any endocrine problem, rule out thyroid. I want to say that one more time. Any endocrine problem, rule out thyroid. If you think you're going to have normal hormones and you have like sex hormones and you have a thyroid problem that's not optimized, good luck. I'm just telling you. I'm not trying to be a jerk about it or anything. I'm just saying like it is. That's exactly how it is. It's going to be very difficult. So you have to understand that if you're going to build a house, you want to do it in a certain order. If you want to have good health, you've got to do it in a certain order. That's why I have probably beat to death in our live streams. Is there an inflammatory process? Do you have stable blood sugar? Are you anemic? Can you carry oxygen efficiently? Because if you can't, your foundational physiology is going to suffer. Okay. Do you have optimal thyroid hormone physiology? Are you autoimmune? And is that why you don't have optimal thyroid physiology? If so, then you've got to address the autoimmunity. And all these things in my approach are, and how I look at this, it's always before the hormones. Like those are more foundational than your hormonal physiology. So just some things to think about here. Like that's why I said it's like an oversimplistic approach. You have to look at the whole person. It has to be a systems-based approach, because we are a complex. We are a complex system. When you try to reduce a complex system into one thing, one cause and effect, and think very linearly, it does not work. That's why healthcare has a challenge with these chronic conditions that we're dealing with, because there's not a drug or a one thing answer to a complex system, because many different things can result in the manifestation of the problem that you're looking at. So how can you have one treatment when there can be multiple causes, and all those causes have you have to address those different ways, right? It doesn't work that way. So I do want to say something else though about when we're talking about like the pituitary hormones for your estrogen and your testosterone and your progesterone. So if you do have like this happens a lot, and this is not well understood. I'll say this, it's not identified very frequently because no one's really doing the testing for it. So let's say you have your pituitary hormones for your sex hormones for estrogen, testosterone, and progesterone, right? If they're high, right, then the brain's trying to signal the ovaries, for example, to make more hormones. Okay? Right? Does that make sense? Right? Just like the thyroid. It's the same concept, right? If the TSH is high, then the brain's trying to tell the thyroid gland to make more hormone. Okay? And so as long as we're not talking like pituitary tumors or anything odd where you would have typically high levels of those glands, but I mean of those hormones, let's just say it's normal physiological range, but it's high, right? It's outside of normal, but it's within what we would say the body would normally make. Those are high. And let's say that you're menstruating female, they're high, and you're unable to get pregnant, right? You might have, why would your ovaries stop responding to the pituitary hormones? Why would they stop responding? You can have autoimmunity against your ovaries, okay? You can have autoimmunity against your ovaries, and then they will fail to produce the hormone because the signal is there, the cells are being destroyed. Just think of it just like Hashimoto's and the thyroid, right? This happens in men all the time. They get autoimmunity to the cells, the Leydig cells of the testes, and they can't produce testosterone. And then they go to their doctor, and the doctor looks at testosterone and rarely checks pituitary hormones. They're just like, oh, let's check your testosterone. They don't, and some of them don't even check free and total testosterone, right? Think about this in the context of your thyroid, right? When we look at the thyroid, you'll hear me talk a lot about, the physiologically available thyroid hormone that stimulates your body's physiology is free. The free hormones, the free T3, not total T3, not total T4, not free T4, but free T3 is the one that stimulates the physiological response. Well, that's the same way for all the hormones. Like your free testosterone is the hormone that stimulates your physiology, not total testosterone. Your free estrone and your free estradiol, those are the ones that stimulate the estrogen receptors. Not the total, right? The total hormone includes the protein bound, the hormone that's carried through the blood via a little carrier protein, right? So in men, what will happen a lot of times too is that they'll have autoimmunity against their testes. Testosterone will be low. They'll go get it checked. They only check the total testosterone, which doesn't tell you, for one thing, about it doesn't tell you about how transportation of the hormone can break down. Remember, 4 phases of physiology for all hormones that has to be considered. Can you produce it with production? PTSD. Production, can it be transported? Right? So sometimes men will have their testosterone will be checked, and they won't be able to transport that hormone well, or they have higher estrogens. And I don't want to get into too much of this because it gets real confusing real fast. This becomes super academic. It's already academic enough, but you end up having higher sex hormone binding globulin. It's a protein that carries your sex hormones to the blood. So the thyroid, if you follow me with the thyroid and you understand and you learn some from me with the thyroid, you understand that the thyroid hormone is carried through the bloodstream via thyroid hormone binding globulin, right? This little taxi cabs. I'll use an analogy of a taxi cab carrying it through the blood, and then it lets the thyroid hormone out, and then it's free floating and it's available for the cells of the body to use, right? Well, all hormones are carried by a little carrier protein. There's thyroid hormone binding globulin. There's sex hormone binding globulins that carry your male and female sex hormones. There's cortisol. Cortisol has a binding protein. I mean, they all have binding proteins. This is why we look at blood proteins like albumin and globulin, these blood proteins that we measure on blood tests. And anyway, with men, they can have autoimmunity against the testes, and you always want to know when you're looking at hormones, is it a primary gland failure? So can the gland still produce it or not? And if the gland can't produce it, then you should have high pituitary hormones, okay? Just like with your thyroid. If your thyroid cannot produce thyroid hormone, you should have high TSH, okay? High TSH. If your ovaries can't produce the hormones, you should have high pituitary hormones, okay? And so this is important. If in men, sometimes they'll have autoimmunity against their testes, and they can have autoimmunity against their sperm, and we can evaluate those things, especially when you're trying to conceive. If you're trying to conceive, it might not be the woman. It can be the man very frequently. Their sperm, they can have autoimmunity against their sperm, against their testes. There can be a lot of problems there. And so what you would see is they need to be checking pituitary hormones because they can have autoimmunity against their testes. And what we'll see often happen is that I've seen men that are given testosterone without consideration of what is happening, right? So put it this way: they'll be given testosterone, but their pituitary hormones are normal, which means that it's not a primary gonadal failure or testes failure to produce it. It's because the brain is not signaling. It's usually some other physiological aspect of, remember, production, transportation, sensitivity, detoxification. is breaking down. Or maybe they're just converting all their testosterone very rapidly into estrogens, which happens. That's why you see so much dad bod these days. Dad bod is driven by aromatization. Your body makes a testosterone, but due to high insulin, high inflammatory load, they just convert it right over into estrogens. And then they start becoming more feminine-like. And that's why you have more gynecomastia, the more female-like breasts that develop, and then a lot of adipose or fat tissue deposit around the abdomen and the hips, more like a pear shape that starts to develop. So stress is a huge issue, and understanding these hormones is not easy. So don't, it is something that, this is something that, hi Elaine. Yeah, this is something that definitely, can create some real significant issues for people, and trying to understand, you don't have to like get all this, but I want you just to understand that you want to consider, you want to consider everything that's going on, and not just, I mean, I want people to feel better, but I think some of these really quick fixes that are being given, I worry about it. I worry about hormone replacement therapy with people, because I just don't know. I mean, I don't, there's so much like that goes into that. And there's so many people that are like, their life's been changed for such a positive way. There are a lot of doctors and celebrities that are huge fans of it, but I think, okay, in the right context, the right situation, for sure, for sure. But I think it's a great thing. But I think there's a lot of people that are probably using hormones, and it's not the right thing. There's underlying physiology that really needs to be talked about and addressed, because I think they'd be putting their health at risk in a serious way by using them. But stress is a huge factor. It comes back to that. Stress is a huge, huge factor with these things. So I just wanted to share that with you all, because I was thinking about it today, and I was doing some reading, and it always comes up. Like when I'm working with people, it is a rare scenario where they present and they don't have problems with their sex hormones, like they just or signs or symptoms of deficiency. And remember, like when you see all these symptoms, right, of high estrogen, low testosterone, all these things that we talked about, you end up, it's not just a quantity based thing, right? It's not just an amount. There may be a problem with the amount of hormone, but the question is like, okay, well, why is there a problem with the amount? Is it, and then you have to start kind of tracking down, is there anything that we can do about this? Is this a primary failure of the testes or whatnot? A lot of this stuff can be evaluated biochemically. Okay. I want you to understand that. Like a lot of this can be with a really good health history and sitting down and talking to someone and, asking the right questions. You can get a great overview of what's going on. Most of the time, I get really good idea of what's happening with someone by just doing a history, just talking to them. Then you can do biochemical assessment, and you can see, does this correlate? Does this make sense? And then you get the more, fine details with testing, and you can really better pinpoint things you can never figure out with history, like specific drivers. You get, it helps you to confirm, refine, and be more precise with your approach with people on trying to help them heal their body anyway. But I wanted to share this with y'all, and I want to try to do this earlier so I could get to bed. All this talk of inflammatory pathways and lack of sleep got me thinking I need to do earlier live streams. So it's very, very interesting. So some of the questions, like Bridget says, "Hey, how do you feel about bioidentical hormones?" I think that I think that bioidentical hormones are better than synthetic hormones. I do. There are, because they're metabolized differently. Synthetic hormones are not bioidentical. Like do you know that you can't even evaluate your body for synthetic hormones? Like we don't have lab tests for those. It's a different hormone, right? It's like when they draw like estrogen, if you're given or progesterone, but you're given progestins, they're different hormones. They're like the synthetics are different, so you can't see them in the blood. Like it's just like seriously, it's just like your It's just like Synthroid or any of the synthetic thyroid hormones. You don't see those in the blood. You don't see those in the blood. Now, if your body takes it and converts it to T3, then it's T3 that is measurable, but you don't see that T4 in the blood. You'll see TSH can be affected because it will impact your TSH, but you don't see that in the blood. You can't. There's no test for it. The bioidenticals, I think, are better because our body knows how to. I mean, when they're broken down and metabolized, we're not making metabolites that are foreign. I mean, I think that like Synthroid and those hormones have pretty good track records. You know what I mean? But I think when you're looking at these hormones, you really have to. I'm personally think that the bioidenticals are more favorable. It's something that our body is not foreign to our body. There may not be any problems with them, and someone can say, "Hey, these are fantastic and they're great for us." But just from a perspective of trying to do what's more natural to my body, I'm always like that perspective. And then I would say that, the bioidentical hormones, though, they're not without risk. I mean, there's the risk of the quantities of hormones still pose a risk if the quantities are too high. If there's problem with metabolism, like it's not just the quantity of the hormones. It's actually, is your body, because people can have like lower hormones, lower like estrogens, but they metabolize them at a high rate, so they're clearing them faster, or they're metabolizing them faster, but they may not be clearing them well from the body, and they have metabolites that have been associated with tissue proliferation, cancer, and other issues. So it's really, again, it's production of the hormone, transportation of the hormone, there's sensitivity at the cell, and then detoxification. Detoxification is especially important when looking at these sex hormones. So, I try to encourage people, try to get all the information that you can on your health before you begin those hormones, so that you can better understand, is there some kind of adaptive process that might be occurring? And then if you're going to take the hormones, I would, if you can do it, you check your metabolism. Unless you have zero hormones, you can check your estrogen metabolism. Let's say we're talking about sex hormones. You can check your metabolism by doing some testing. And then when you take the hormone, you take it for a few months, and then you can check your metabolism and clearance of the hormones again, and see if you're making some of these higher, these metabolites that could be dangerous at higher rates that might cause some problems for you. There's just a lot out there. There's a lot of things that it's complicated, but at the core, it comes back to okay, what can we do at a very foundational level to address some of these problems, right? And let's get back into the diet, you get back into lifestyle and things that have a systemic impact on your physiology. And I think that's what we really have to focus on, is those dietary factors, those lifestyle factors. And then, if you're in a position that you can do it, then get testing and be more specific, formulate real specific plans to try to address and support your biochemical individuality, so that you can really be specific with what's happening. Because, unfortunately, there's just things that we see with testing we would never figure out doing just dietary changes and lifestyle changes. We'd never know, because you can't know unless you have a quantitative marker that says, hey, this random thing is happening. And this can be a big contributing factor. Like some people have, some people have infections of some sort, or parasites, or something going on that is, you wouldn't know unless and because they don't always have GI symptoms. Like people make assumptions like they're going to have GI symptoms. No, you don't have to have GI symptoms to have bacterial overgrowth or worms or anything else. You don't. So it's really interesting that you might not have a ton of symptoms, and it doesn't always mean that you're going to be expressing, a symptom if you have a problem like, let's just say, a bacterial overgrowth in the gut. I mean, I saw that firsthand with many people that we've worked with, just doing stool panels and coming back with high levels of bacteria, and they're like, oh, my gut's fine. They wouldn't even really say they have a digestive tract problem. But anyway, it's just really interesting. So, I want to share this with you. I know it's a little bit, it's pretty academic. I think a lot of people might tune out, but you know what? If you really want to try to understand what's going on with your hormone, you have to try to be your own advocate. And and you become empowered. You don't have to know everything, but you can get basic concepts like the stuff I just shared with you on pituitary hormones and estrogens. Those are things that you can understand. Like if you're going to get hormone replacement therapy, you want those pituitary hormones and your sex hormones checked. And ideally, you would like to have estrogen metabolites evaluated. And you want to know, like, do I have a primary failure of the ovary, or do I have some type of adaptive stress response that's causing me to not be able to make the hormone? Or maybe I'm aromatizing or converting the hormone into estrogens, like if it's testosterone, more rapidly. And you can look at like 5-alpha reductase activity. And there's all these things you can look at to give you more clues about what's actually happening, so that you can say, well, maybe that hormone replacement is the best thing. So, it's just always, and then you get complicated, and you're like, you want to throw your hands up in the air and say, who can understand this, right? I get it. You can always say, I can eat right, and I can sleep right, and I can move, and I can try to manage my stress, and I can make sure I'm not deficient in nutrients, and I can do these things to have a hormetic or system-wide impact. Okay, and that's what we all have to do anyway. That's what we have to teach the masses of people to do, to try and do something about this wave of chronic disease and issues that we're faced with. Our families, our kids, everybody's sick with something. Everybody. I cannot believe the people around me in my life that are sick. I cannot believe it. I do believe it, but because I know the statistics, but I am upset by it. I see a lot of lost opportunity. I see a lot of lost quality of life. I see a lot of lost contribution to society that people want to give that they can't. I see lost hopes and dreams. I see a lot of stuff, and it's just absolutely ridiculous. It just really makes me angry, quite frankly. Because these people live a shell of their life. Really, really bothers me. And it could and I think so much of it could be different if as a society we looked at things a little bit differently, and we had some different values in the way that we lived our life. It's hard because we're all forced into this we're our society and is drives us to be more focused on productivity at the expense of our health. It's this it's not just an American thing. I mean, it's many cultures are, like that. But I think that the Italians and all those people have it right. They take the huge break in the middle of the day, slow it down, and life's different. It's why they outlive us. It's why the Mediterranean area, I think they live longer. It's their epigenetics, their environmental impact on their genes is good. You start looking at these blue zones around the world where these people live to be centenarians, and yeah, sure, there's genetics, but there's all of these environmental impacts, right? So we have to start looking at this and figuring out how can we change this, not just for us so we're not like chronically sick and we can do something about where we are individually, like right now, but also for our families and our kids. I don't want my kids to have this be faced with this, and I feel like they're just like, how did we get out of this? We're sucked in. And then you jokingly say, well, we're just going to go off grid. Well, I don't think that's really the answer either, because that doesn't answer anyone else's problems. I don't know that would answer my problems, but that's very much an inward selfish focus. I'm trying to figure out how do we do this for everybody. So interesting concepts, but I just I really appreciate y'all. I'm not gonna stay on here any longer. I'm gonna try to get to bed. You should too. You guys really focus on 8-9 hours a night. Focus on that. Set your schedule. Try to do that every night, and that can be a big way to upgrade your health and and really make some really positive changes in your hormonal physiology and everything. I know sometimes people can't sleep, so I get that. And if you guys are trying to figure out like what to do, like seriously with all this stuff and the lifestyle things and where to begin, you should join us for our challenge that we're starting. That's getting ready to start in the next few days. It's going to be awesome. It's going to give you like dietary and lifestyle recommendations that we've used with a ton of people clinically. And I even go into the supplementation that's basics. It'll give you the things that we've seen work clinically for years and that we've refined. So it's a good starting point if it's not an option to get testing and really be evaluated to understand what's happening with you as an individual. It's a good place to start with dietary, lifestyle, and supplementation changes. So definitely, consider doing that if you're just trying to figure out what to do. But I have a ton of videos on a lot of these topics that we talk about. And so you can always go there and start learning. But remember, the goal here is we really need to focus on educating ourselves so that we can be active participants in our healthcare, working with our doctors. We're not just having it done to us. And that does not mean confronting. That does not mean being adversarial. I want to really discourage bad attitudes. I know your doctors may have bad attitudes, but a lot of us have bad attitudes too. And so I want to, let's not carry that stress. We don't have to do that. You don't have to be upset. You don't have to be upset. You might have plenty of reasons to be upset, and that's okay. It's okay to feel bad sometimes. It's okay to be angry. But we have to make peace with that, and we have to not let that control us. Okay? Because that's part of the stress response there, right? It is. It's that choice, and easier said than done sometimes. And you can be mad at me for saying that. That's okay. I just wanted to let you know that we have to try to figure out a way to do this cooperatively, because we cannot do it pushing back so hard. I don't think that's the right way to do it. So anyway, hope this helps you guys out. Hope you'll have a wonderful, wonderful night, and I'm going to try to get to bed. But I really do appreciate y'all. If y'all have questions, comments, post them here, and then we'll figure out something else to talk about tomorrow. But anyway, appreciate you guys. Hope y'all have a wonderful night. Talk to you again soon.